subcutaneous injection or less than 1 ml. This the tuberculin syringe नाही का? The nurse should use a tuberculin syringe to administer the subcutaneous injection less than 1 ml.
कोणी जोडले बरं.
For adults, subcutaneous injection should be 25 gallons. For infant,
एक जोड
elderly or very thin patient, 25 to
अबो
35 middle. Before administering drug, the nurse should tell the patient by checking bag and the patient status name. To clean the skin before the injection, the nurse uses sterile alcohol swab to wipe from the center and the site of outward the circular motion. The nurse should inject the heparin deep in the subcutaneous tissue at a 90-degree angle perpendicular to the skin to prevent the skin irritation. If blood if the blood is aspirated into the syringe before intramuscular injection, the nurse should withdraw the needle, prepare the another syringe, and repeat the procedure. Okay. If blood is aspirated into the syringe will be aspirate the blood before an intramuscular injection. The nurse should withdraw the needle. Needle withdraw करते हैं prepare the another syringe. And repeat the procedure. The nurse shouldn't cut the patient hair without written consent from the patient and appropriate relative. If the bleeding occurs after the injection, the nurse should apply pressure until the bleeding stops. If the bruising occurs, the nurse should monitor the size of an enlarging hematoma. When providing hair and scalp care, the nurse should begin combing at the end of the hair. Should begin combing. Comb at the end of the hair, work toward the head. The frequency of the patient hair care depends on the length and texture of the hair. केयर नाही डिपेंड करायचं त्याची लेंथ किती आहे टेक्स्चर किती आहे the hair duration of the hospital and patient condition proper function of a hearing aid require careful handling during the insertion. Proper functions of a hearing aid require careful handling during the insertion. जब hearing proper पाहिजे तर hearing aid properly करायचं and remove करायचं. Regular clean करायचं of the earpieces to prevent the wax buildup and promote the replacement of dead batteries. Replace करायचं ते dead battery आहे. The hearing aid that marked with the blue dot ने mark करायचा. It is the left is for the left ear. The ones which red dot is right in the ear. Blue dot नाही का left साठी आणि right नाही का red साठी right. Hearing aid should not expose to heat च्या जवळपास आणायचे आणि humidity पर्यंत आणायचे. I should not be immersed in water पाण्यामध्ये नाही टाकायचे. nurse should instruct the patient to avoid using hair spray while hearing and hearing aid. नाही का नसले पेशंटला इन्स्ट्रक्ट करायचं आहे की हिअरिंग स्प्रे यूज नाही करायचा आहे जेव्हा हिअरिंग एड कमी आहे तेव्हा. फर्स्ट द 5 branches of pharmacology are pharmacokinetic, pharmacodynamic, pharmacokinetic, pharmacotherapeutic, toxicology and pharmacognosy. These are the 5 branches of pharmacology. Five branches of pharmacology, the 5 branches are pharmacodynamic, pharmacokinetic, pharmacotherapeutic, then to remove the hill, okay, every 8 hours to inspect the food for the sign of skin.
माझा असंच बंद करून
Hill नाही का
नीट चालते ना
रिमूव्ह करायचा.
असं
Then I should remove the hill every 8 hours to inspect the food for the sign of skin breakdown. Check करायचा काही breakdown होण्याचा skin. It is applied to promote vasodilation.
ये का तो होता सब
Vasodilation promote करण्यासाठी कशा करता
थांब
which removes the pain
लगा
caused by
नाही
inflammation.
सांगलो ते
Inflammation
पडते का ते
खाण्याचा
एका सोडा
तो reduce करण्यासाठी.
या 10 वेळा दाबून ठेवा सोडा
A suture surgical incision is an example of healing the first impression. Healing. Directly without granulation. A suture surgical incision is an example of healing by first injection. Healing directly without granulation. Healing by secondary injection. Healing by granulation. पहिला healing by first injection मध्ये नाही का? First injection मध्ये granulation form नाही ना दुसऱ्यामध्ये granulation form is closer of the wound. When granular tissue fill the defect, okay, and allow the remethylation to occur, cleaning wound agent and keloid formation is an abnormality in healing. Keloid जर formation झाला, एका abnormality आहे healing ची that is characterized by overgrowth scar tissue or keloid formation is abnormality in healing that gets by overgrowth of scar. Scar ची overgrowth होते at the wound site. The nurse should understand panting upper outer portion of the buttock, the adult or middle lateral of the thigh, in the side. The nurse should massage the injection site. An ascending colostomy drain. An ascending colostomy drain. An ascending colostomy drain fluid pieces or descending colostomy drain storage fecal matter. Ascending colon नाही का? Ascending colostomy drain fluid pieces. Fluid सबक pieces drain करते हैं and descending only solid fecal matter.
याच्या घर कसं चल चल.
A folded towel total bridge can provide a total support for the patient with a total edema. If a folded towel total bridge can provide total support for the patient with total edema cause vasectomy, epididymitis, and otitis.
ना हत्तीने मारलं रे एकाच्यात.
Then giving an injection to the patient who has a bleeding disorder. The nurse should use a small gauge of needle. Apply pressure to the site for 5 minutes. ठीक है? जब bleeding disorder है तो small gauge of syringe use करा दिया है. Apply pressure for the 5 minutes after the injection. Platelets are the smallest most fatal form element of the blood that are
एवढं सांगायचं मला.
essential for a coagulation.